flat, wide open.
So this you don't have to do a lot of
So,
finagling.
but can you cut these and it will still remove the chest piece, right?
Yes, you have
Yes.
to cut those.
Okay.
Yeah,
In
you
order
still
for it to
have to-
open, you
so-
have to cut the middle pieces.
I guess my question is with this, if we pull the ripcord, what does it exactly do?
Yep.
It flaps everything wide open instead of
Okay.
staying like taut here.
Yeah.
Gotcha.
Like a lot of them, if you just cut where is that? If you just cut these are still in place. They don't go anywhere. They usually go up. These ones will go open so that you can slide it straight up from underneath them.
And I think it unhooks in the back so it's like apart. That way you don't have to lift up and over. Any questions about the equipment? Again, we do not have the chin straps on
Okay,
the
so I
helmet.
have some silly questions. for
Yep,
you.
nope, go for it.
What are we cutting here if we have somebody that is down on the field, has a broken shoulder? Dislocated shoulder.
So, take no offense to this. I'm not gonna call you unless a kid is unconscious or has a head injury or neck injury. If they have a dislocated shoulder, I usually handle that myself.
Or our team doctors there for varsity.
Yeah,
She can put it back in.
Okay?
Yeah,
Who
we
is your team
usually don't take this off until we get the shoulder back in.
Gotcha.
Who is
Yeah.
your team doctor?
Dr. Kalisa Morris is our new team physician. Dr. Brian Fixler used to be our team physician, but he is stepping away to take care of all the urgent cares at OSS. So Kalisa is new to OSS.
She
Ironically, she looks like my
Looks
twin.
like Leah, yeah.
Yeah, so if you see someone that looks like me, it's not me, it's her.
At home varsity.
Yeah,
games,
right now she has highlights, but they'll probably be gone with the fall. But
Okay,
yes,
so when are we taking these off?
the only reason would be if we are transporting them and we, like for a
They're now ours.
cervical. Yes.
Gotcha?
Yes, when they're yours, you guys can take it off, or we probably will take it off if we deem it necessary. If they look like they're going to cardiac arrest or having any issues breathing that they could need access to the chest, we will remove it for you.
That's
If
enough.
this is, it is when you guys are there for a game situation.
Mhm.
If it were a practice situation, this stuff is already gonna be removed. Because we have.
So we're
student
actually
aides
coming
that-
out in the field, is what you're basically saying?
Yes,
Okay.
yep.
Who here does cover for our games, our football games?
You have, yep, yeah.
She does.
Okay.
So I have a couple questions,
Mhm.
and I'm not meaning to sound offensive when I ask these questions.
Go for it.
So we have specific protocols regarding cervical spine immobilization,
Yes.
correct?
Mhm.
It is not recommended anymore unless the patient has paralysis, numbness, cervical spine injury,
Mhm.
that we put them on a back.
Correct.
They get a cervical spine C-collar. Is that what you guys do?
It depends on the situation. So if you
Okay.
have a kid that is laying on the ground, not moving, unconscious, we're gonna put them on the backboard because we don't know what is going on with them. If a
Okay,
kid comes off the field and says, Sheila, my neck is killing me, my hands are numb. If they already came off the field, she's probably gonna sit them down and immobilize and then have you guys come over, kind of thing.
immobilize how? With just
So I should say motion restriction versus immobilize.
Okay.
Sorry, that is an old term that
Yes.
we are very used to. Immobilize, immobilize, immobilize. They have changed that to be restricted, I think is the wording that you guys use now, correct?
stabilization.
Stabilization, restriction. A lot of times they say the backboard, everyone's phasing away from it because how long are they gonna be strapped to that? A lot of times what they have been using it for is you get them from the ground to the gurney and get the spine board or backboard off, and then you transport away from that. Because there's respiratory issues, it's uncomfortable, if they're not on there correctly and something's jabbing into them, it's causing more discomfort and issues rather than being on a gurney.
So would there be an issue if we arrived on the scene and we removed them from the board?
No,
No.
they're yours, like as
Okay.
far as I'm concerned, like.
Okay,
I actually think that they should be taken off unless it's
Makes sense.
catastrophic and they absolutely have to be on there.
right,
Kind of thing.
okay.
Yeah.
That was just one of my questions I had.
Yeah, and you have full permission to drive on the field, on Chapman. Like, full permission to drive around the track or on the field if needed. Whatever the quickest safest way is, you have permission to do that.
I think that goes for the turf too.
Yeah,
There.
I think they would prefer that over coming out with a gurney and kind of taking your time.
Too tough.
Yeah, too much time.
Yeah.
So, I think, any more questions? And I did not find that offensive at all.
I
Thank
just
you.
wanna make sure, cause
Yeah.
again, things have changed for us out here.
Yeah, of course, and that's why we want to do this every year, because it helps us learn too, and establish good working relationships, because, unfortunately, emergencies happen and we call you.
What
so.
are your guys' protocols for a backboard?
So again, well, anybody wanna speak up, or is it just gonna be me talking?
I know it's like intoxication,
You're having a good
someone's
one,
intoxicated or on
altered,
drugs,
intoxicated, unconscious.
last coma scale under 15.
Well, no,
Sure.
not even a GCS under 15.
Oh, really? Okay.
No. Intoxication, like numbness, weakness, paralysis, those patients, altered mental statuses, again.
Like basically a suspected true spinal injury.
Okay.
In other words, we're using them for basically extrication purposes to move on and transport.
Correct.
That's it.
Okay.
So what you're saying is if you call us out to the field, that patient now becomes ours?
Yeah.
Once
Right,
you take
but,
them.
yeah, once you take
We
them,
are in
yes.
charge
Yeah,
until we
'cause
give you that.
Yeah,
Does that
I'm
make
usually at C-spine because I'm the first one there, like, at the head.
Does your physician, obviously, she comes out in the field, or he comes out in the field, right?
Yes,
Um,
only on varsity games.
just on varsity, so
Varsity
you're not
home
there for
games.
JV or any of those?
No, I'm by myself. Yep,
And really by yourself, because there's no opposing athletic trainer that comes for those.
true, yep, for all three of them.
So here's a kind of random,
Varsity, they come.
Oh, right, yeah, sorry.
just a random thought process that actually really has nothing to do with this. But if, let's say we have a patient that is injured, player that has gotten injured, we come out, we do our assessments and things like that. Do you guys carry anything that states maybe any allergies or any medications that they take?
Yep.
That you would be able to provide for us
Yes.
on the field while
Yeah,
we're
we have an emergency athlete card that
The
is
coach.
yellow, and well, I have it with football. And, we will hand that directly to you if the parent is not there. We will usually hand it to you anyway, but I would think if a parent is in the stands at a home game and they see their kid on a stretcher,
Right.
they're gonna come down anyway.
Right.
So, they're gonna give you access to all that information. But yes, we make sure that you have all that, and on the back it has consent. So let's say it is a situation where a parent is not there. This is why last year was so difficult for us, because we couldn't have parents at the game. So, but on the back of those cards, it gives a statement of consent to treat if the parent is not available to be reached, and they sign it. And
That
we-
includes for emergency
Yes, yep,
medicine like us.
Yep, that's why it is there.
yeah.
If there's an emergency situation and you guys have to take them, we give you the card so you have all that information. We have their physical in hand at school, so we have that information. This is more for you guys, so that you have it and the consent to treat them, because 99% of the time they're minor.
What is on your card other than meds and allergies and consent?
Preferred hospital,
Insurance.
insurance, contact information for parents, or
Age.
guardian, or whoever they're with, kind of thing.
Date of birth.
Perfect.
That's a good idea. Next year, we need to remember.
That's a really good
so they can see.
Any other questions? Okay, all right, well, Nate, let's get you set
Get you
up.
dressed,
Nate
Nate.
has the stature of a football player, so.
Would make sense if Sheila and I did it. We're be like the E3 team. Let's do the record.
Yeah.
What's nice about this one is that we can just, I say go ahead and do the back leagues,
And then we can
And
put
then
the screws back in, so it's.
and they can practice with it, or whatever.
Maybe one of them will be that. Alright, so I think we're gonna do two different scenarios. We're gonna do one with a patient supine and one prone, because we're gonna show you how to, when they're supine, it's pretty easy, you just stabilize. When they're prone, you have to turn them and stabilize at the same time, and it's kind of a unique touch. You have to make sure you're not crisscross, and then everything flows together.
Go ahead and just lay down.
So I'm gonna pretend to be one of you lovely people. So if Sheila's on the field,
Oh my gosh, Nate! No, I would never act like that. I would never act like that. stabilize his neck
Yeah,
while
okay,
removing
so I'm just
the
gonna
helmet.
move your arm, stay right there. So I'm gonna go directly down underneath. Basically snuggle his ears,
You let me know when you're ready.
and I'm gonna hold basically the base of the occiput. Yep, I'm good.
Okay.
And a lot of times if someone's really big, you can lean on their chest as long as they're not having issues breathing. So see, Nate's head, no offense, Nate,
Got
but
it.
he's a decent
You can
size like a
release.
football player. So you really have to make sure you get under there and hold it. And then I'm gonna release when she tells me to.
And then this is when she would remove the shoulder pads. And then she can
Snip,
yep,
snip,
snip.
snip. This would flap open. Unfortunately, we're not gonna do it. But then we
So
would
yeah,
just
for
be
the
able to
purpose
slide.
of like not ruining these shoulder flat pads, we're gonna take this off.
Oh, that hurts.
Okay.
Okay, so then we would be able to basically just slide it out from underneath him with some assistance.
And then this is when you guys come in.
So you don't carry cervical collars?
Nope.
We leave that in the backboard to you guys. We don't have any of
Is
that.
that, that's an interesting dynamic, the amount of space that's between his head
Towel.
Yeah.
and,
And that's usually another thing, is like, I always had a towel on me, but you guys always have towels too.
We can also collar him with the helmet on as long as it can fit underneath there. But a lot of times it won't because they're so big. So someone has to hold it while she pulls that out, or else he's gonna fall into extension, and that's gonna cause a lot of issues. But the problem is, a lot of times you wanna try and do it simultaneously. If you have enough people to remove the helmet and the shoulder pads at the same time, that's ideal. She may not have that many people that can help her do it correctly while they're on the field, unless you have all four of your student aides, plus Dr. Morris, plus you guys.
And this is something like, they're high school students, but they're student aides, but they're highly capable of following instruction if need be. And I know they are, because I wouldn't pick them to be a part of our internship if they weren't. So, and this is something that I am gonna go over with my students, just as a repetition thing, so that they can get comfortable with it, because high schoolers tend to freak out sometimes.
Like, oh my God, what's happening? Do you need me to do something? Like,
because, and I get the whole towel thing for you guys, but we will remove the towel.
Yeah, and that's the
As soon
thing.
as they go on the stretcher.
I don't even, I wouldn't put a towel there, I'm just
Yeah.
saying, I know for
I mean,
space
that's-
purposes,
yeah, that's a lot of
sometimes it's
space.
needed.
and this is if they need their helmet and shoulder pads removed. If they're having issues with breathing and you guys would have to access their chest, we're gonna take the shoulder pads off, which means the helmet has to come off. If they're just having issues with their cervical spine, we're probably only taking off the face mask so you can access their airway. We're gonna package them with shoulder pads and helmet on the back there. But I know a lot of ERs don't want the liability of removing equipment, and the person that
So
is
we
the
are-
most experienced with the equipment is supposed to remove it.
Right.
So we would most likely
Take it
remove it, no matter what. And that's always fun, because you have to cut their jersey off and all that stuff, and go through that motion.
What does your physician do for you?
So this is my first year working with her particularly, so I don't really know her that well. But I'll speak of Dr. Bixler, and he fully trusts whatever we do. If it is a situation where like, I'm just kind of unsure, or I need his eyes to look at it, like, I'm trying to think of an example.
He was a very good support.
Yes, support
He
for us,
wasn't the
yeah.
person that ran out and did everything for us. They want us to be hands-on, we know the kids, we know our emergency action plans, we know how to treat. It's more like if we have someone that dislocated a hip, Dr. Morris is gonna put it back in because we don't have
Yes.
extensive training on that. We don't have a lot of training on elbows, we do a lot of fingers, we do a lot of shoulders. But if it's
And
like a
patellas,
catastrophic
yeah.
injury,
Do
they're,
you send them to the hospital though?
I don't, because I love dislocations, and if we feel like, if we know upon our valuation, we don't think there's like a femur fracture, I'm not gonna send them. It's something that,
or
I don't know, we're
they
just
like don't have a
used to,
pulse.
like we know.
That's an interesting concept, because what do you medicate these kids with? Tylenol?
I mean, it feels better when the joint is back
I
in,
know,
so.
And do you do that on the field?
Yes, yep,
Interesting.
yeah.
So a lot of athletic trainers do not have that in what's called their SOP, their standard operating procedure. Dr. Bixler was comfortable with us doing it, so he put it in ours. So we are allowed to relocate. Now, a lot of times, depending on the person, if they're super apprehensive or if they're in a lot of pain and we can't get it back in, we're not gonna keep pulling at it for 10 minutes. We're gonna package them and send them.
Or I would send them to, and this is not offensive to you all, because I know how time works. And so I'm gonna tell the parent, it's gonna be a lot quicker if you go to a orthopedic urgent care and they can get it back in quicker versus going to the ER or me calling 911.
Right.
I mean, knock on wood, that's never happened to me. I have had one really hard shoulder to get back in, but it was in the pouring rain, and the kid already had a repaired shoulder, so it was actually extra tight. So he just tore one of the sutures, and the way it dislocated, it was just difficult to get back in because the sutures were so tight on knowing this now through the MRI and everything, because, you question yourself and to see was it me, was I inadequate, was it raining and I was slipping too much, but it took two of us, like literally going like this and like leaning back and pulling on his arm to get it back in. But that was the longest it took, and I would say maybe 5 minutes, maybe. And that was long for me. Like I was like,
Fixer also tries to have the kid do it himself. So if it's a shoulder, he'll have them sit down
Yeah.
and grab their knee like this, and he'll have them relax and just do like a sulcus, where they completely relax and lean back, and just that traction should put it back in.
And I would say 8 times out of 10, that's what I do. I don't even touch them when it comes to shoulders. You just calm them down and instruct them that way.
She loves fingers. She's like, oh yeah, I got it. You're good. Can you move it? Do this. I don't think it's broken, but you probably should get an X-ray just in case.
If it happens to a football player, though, they're like, just take me up and send me back.
Do you want to do a prone one so they can see how we roll?
Yeah, sure. But you were gonna need help. That's the only thing.
Yeah, so I was gonna say,
Do we have a volunteer?
we're probably gonna need more than that.
Yeah, we'll help you. How many do you need?
2 more?
2. Let's go 2 more.
2 more.
Total. Yep.
We
Okay.
got 1. Don't be shy, don't bite.
Sorry. And how about we go
Yeah,
this
go ahead.
way? Let's go this way because I didn't realize. I apologize. My back was turned towards you.
Wait, what? You got it back in?
Nobody else will
Good
call.
job, Nate. Tater. See? Man thumbs. Man thumbs. It's because he's sneaky. Alright, so you're gonna be on your stomach with your head tilted one way.
We probably should have them come in and call us with all that stuff and do that.
Yeah, definitely. I would say not right this second, but
Yeah,
like we can go through it. Sure.
So this will be, let's just take up from after you've done your evaluation and you know your spine.
Okay. So I'd be here because when we turn, he's gonna be going this way. That makes sense. Okay, Leah, I need your help.
Alright, what do you need me to do?
And I need your help. You're gonna be over here, Chris, and I'm not.
You're good. So what we're gonna do is we're actually gonna, nope, Nate, you just be calm, okay? We're gonna pull his arms to the side because if we have to roll him, if his arms up like this, that's not gonna be a happy transition. So we're gonna roll both of them here, okay? What you're gonna do is you're gonna come up next to him, you're gonna put one hand here, one hand up here. Go ahead. Okay, and then you're gonna overlap her. So you're gonna be ankles, yeah, there. And then Sheila will be the person that counts. Okay, so whenever she
So
counts.
on 3, 1, 2, 3.
And then we would take over.
Yeah, need to remove.
Oh yeah, I need to remove his face mask. Are we actually taking everything off, or are we just stabilizing?
We can just, I mean, if you want to
I can
just
take it
stop
off.
here, we can stop here and then
Yeah.
have everybody else practice if they want to practice
Yeah.
like removing.
Yeah, why don't we have
that's fine.
practice?
Yep.
Should I write
Okay.
down? Okay. I thought he was holding it up. I was like, oh gosh. So whenever they're prone, we have to get them supine, but we want to do it with the least motion, and obviously we have to go at Sheila's speed. So if we roll too quickly and she doesn't have a good hold on his head, if she drops him or whatnot, it's going to lead to damage.
So we're gonna practice this too, right?
Yep.
say that we put a C collar on,
Yep.
an helm, right?
If they're small, if you can get it underneath their
A
neck,
small
like
kid or a small helm?
a small kid, because their neck is gonna be smaller. Nate is in larger stature, and a lot of our football players are, so you're not gonna be able to get underneath there.
Okay.
But someone with my size head, and we do have some twiggy kids, with that big helmet on, you probably can access my neck.
You want to try the
That-
color?
That was,
Sure.
I wanted that.
Can we do the necklace?
That's
Here's the adjustable. Here's the adjustable.
Oh, we did it again, our backs are bad.
It's a bad thought.
I was gonna say, wait a second.
Another question was,
Nate,
when
what's your
he's
fault?
prone, instead of having to roll him again, could we put the backboard there so he's just
You
coming
can.
right over onto it?
Yes, it's just harder to get the equipment off when they're on the backboard because
Okay.
they catch over here. So,
That's a really good question though.
yeah, that is valid, because we could do that, it just takes a little bit more shimming to get all of the equipment off. Especially these things, they catch a lot, but if it's an emergency, we're cutting it, no matter what, so it doesn't matter.
Great question.
So what kind of medical equipment do you guys carry on the field? So you go out and you have a football player that's not breathing.
We have
AED,
That's what you guys carry?
Yep, so she'll call to the students, get the AED now, and we have it on the outside.
splints.
Vacuum splints, right?
So you don't carry like a BB and airway stuff?
Do you guys have simple face masks?
Like for, yeah, for,
Like just for the breathing?
yes,
like rescue
yes.
masks?
yeah, CPR, yeah.
I was gonna say, if not, we have some.
We'll take extra.
Yeah, we actually, no, we will take extra.
We actually
no.
were talking about that in the spring,
No,
I was like,
yeah.
oh crap, I only have this
Well, mine
one.
was dry rotting. I opened it, I was like, oh gosh, I need a new. Like,
Yeah.
dry rotting.
Yeah, we have extra ones for sure. Yes, we have those, we don't have, oh, we
No, we
do.
do.
We do, we have
Yeah.
one at the high school and one at the DSF, never mind.
I don't have one at the DSF.
You just have it at the high school.
Yeah,
Okay.
just because I don't feel using it, so I'd
Yeah.
rather.
Okay. So what do you want to practice? Do you guys wanna,
Let's turn.
you wanna turn them?
Okay.
I'm getting out of the way, you guys are up.
Nate,
You're gonna do the head though, right?
let's do
You're
this.
always good.
Yeah,
Yeah,
her
she's
head
the
this
head.
way, that way everybody can see, yeah.
She's okay.
That's fine, you can roll here. Okay. Okay. And so you're just gonna, if you can put your,
Those two are gonna be over there, right?
You're gonna be whichever way you're rolling.
This
whatever
way?
way, yeah,
So
we're
to
rolling
the
him this
people
way,
that
yeah.
way. Yep. And when you guys backboard, do you cross their arms and cross the strap so that they are secured in?
Okay, or do you feel attached?
Oh, I can. So you can have 3 or you can do it 2, it's fine.
Yeah,
Yep, on 3,
Better.
1, 2, 3.
Now see how he lagged? So we probably want you to move up a little bit more so that you could grab his shoulders and then his hips and then you would cross over
Sorry, Nate.
like abdominal and then like knees. Oh, sorry, Nate. So move, yeah, so you wanna like have his shoulders.
On
Perfect.
3, 1, 2, 3.
And we're still lagging a little bit.
So let me ask you this question.
this is like.
So when you're rolling them from the prone position, is it acceptable when they have their shoulder pads on to put their arm above their head and use that as a splint? Do you understand what I'm saying?
You could.
So-
You could.
I'm sorry.
Yes, no.
Can you roll back over a minute?
Sorry, Nate.
And tuck, I mean, I don't know how pliable these are, so.
That's the only thing, because when their jersey is on,
It's
It
super
doesn't
it's,
talk.
this doesn't, it's not flopping.
Movable.
It's,
Okay.
yeah, it's like right here.
Yeah.
I don't think we'll be able to get it off.
Yeah, I don't think they would be able to do that. I think that's why we were always taught to have the arm down.
Yeah.
So you can have 3 people, let's do 3 people on that side. Why don't, one person here, one person here, one person at the legs.
Nate, can you give us feedback too, like how you feel as.
So get up closer to his
the
shoulder.
patient?
I'm gonna have you
Like,
all the way
is there
over
too much movement?
You are gonna come here and be in the middle of the knees.
Yeah, that's.
Yeah,
And then you need someone at the feet so that the feet are.
Okay.
Okay, and on my
And
count,
you're gonna cross.
1, 2, 3. That was much better. Better?
Feel better now?
Yep.
His shoulder's up there, I don't see it, put it back in.
Anybody else? Do we want to practice getting him on to the back?
I would say yes, because,
That's what they're gonna do.
does somebody want to practice with doing the removal?
So in the back, you don't have to worry about that, because he's gonna be laying on his back, and you're only gonna cut the front and the ripcord, and it'll
And
lay
this is
wide
gonna
open.
split up wide open.
So, here's my next question.
Yep,
So you're laying on your belly. We cut those 2 tabs up, we roll them on the back, it'll come right off.
but you have a jersey on, that's the only thing.
Well, if I'm going to the point where I'm cutting that, I'm cutting the jersey.
Well, that's
What
it,
the-
we're
no,
gonna
what
cut the
I'm-
front of the jersey already and
Yeah,
go.
that's what I'm
Not if
saying,
he's laying on his belly, you're,
but we have to roll him first.
We're never gonna transport him on his stomach, so no matter what, we're rolling him.
I guess, I think you're missing my point.
Before we roll,
So, right, can we cut before we roll?
because then it helps us do a full spine assessment. as
Right,
well.
because now I can run, so,
I think it's extra time not needed, because when we roll to the front, you're gonna have to cut these right here and the front of the jersey anyway,
We have to assess.
Or we're just gonna
to
have to-
access the front.
lay down, back like you were. I think you're, So-
Yeah,
They wanna look
understand
at the spine, they
so
wanna
when
palpate the
like when
spine.
we ride, come on the scene.
gotcha,
And this is for any auto accident, anything that we come to, and we're assessing a spine,
okay,
we're running our hand down their spine and down their back. So we're gonna cut the back of his jersey and cut the back of this up so that we can see his back. Do you know what I mean?
gotcha. Are you still going, would there be something that would determine not to spine board him and not to roll him through that evaluation?
Wait a minute, back up. So you're asking me,
Because you're saying you would like to do this first before rolling him.
right,
Yeah.
the only thing that would change that is if he isn't breathing or has an airway issue.
Okay,
That is what changes that. for us.
but you would spine board him regardless.
No,
If he's only complaining of cervical neck pain, we only have to put a collar.
Collar on.
right.
If
Okay,
he has nothing in the remainder of the
But we
spine.
still need to look at his spine and his back.
So when Sheila goes on the field, she is going to do an assessment. She's going to say, Nate, can you hear me? Can you hear me? What's wrong? What's going on? Your neck hurts. Okay, I'm gonna palpate really quick, okay? Where's it hurt? Tell me whenever I hit it. Right there, okay. As I go down, can you feel anything else? Does that bother you? No, it's only your neck. That is when she's going to say,
Okay.
I need to stabilize, get the other athletic trainer and get the EMS now.
Okay.
So she's gonna do a quick
Again, I'm not trying to be difficult.
Oh, no,
I'm
no,
just
no,
trying to
no,
figure
we
out-
like to question.
We fit
Yeah.
this whole process, and when I look at doing this, it's kind of more cumbersome to roll him on his back, take all his gear off, because now you're shimmying the gear around. Do you know what I mean?
I understand, yep.
Versus cutting
So
up the
if
back
he
of
was
the gear.
complaining of like thoracic or lumbar pain,
Yeah,
I could see you being valid. Let's
Yes.
cut this, let's palpate, let's see exactly what point it's at, and then let's roll. If
And
he's just complaining of cervical spine pain, that's redundant. We want to get him over collared and get the process going.
Yes.
right, because if they have thoracic or lumbar pain, they're still gonna be bored. We're gonna fully immobilize them at that point.
Yes.
So, okay,
Yeah, sorry, I wasn't,
sorry.
no, it's okay.
And I think the
This
problem
is
is
great.
whenever we think about spine boarding, a lot of times we're thinking neck. Like they have a cervical spine injury, they're having paralysis, they're having numbness and tingling, something's not right, they're not moving. But we're gonna say, can you move your toes? Can you move your fingers? A lot of times is we will, I shouldn't say immobilize, but control C-spine like this and be doing other things with our hands,
We're
okay?
talking to them,
We're talking to them.
evaluating them through the process before you guys even come on the
Yeah,
field.
so she's never just gonna get out there, but he's not moving, ambulance, come here, we're gonna spine board. She's gonna do that thorough. We just skipped that part because we wanted to get right to the practicing part when you would be entering the field. Does that make sense? But yes, that is valid. If he was saying, my upper back down to my mid back is really hurting, and if you wanted to check for point tenderness or defect, cut, like, you can't.
Or like, I
Sure you
mean,
can.
this is
Like,
kind of like.
I just don't know where these would go, because it's not designed, like,
So,
when you cut the
would they
front
separate
hair,
here?
they would come this way at you.
Well, that's okay.
Yeah.
So,
Sure.
if I were doing this, so, and he had a jersey on, we cut the back side of his jersey, right, cut up his arms,
Okay.
cut this piece, right?
Mhm.
So this, because this piece isn't attached, right?
Correct, it's just.
We cut here, and it would fly right off.
Gotcha.
I mean, at that point, I get we're trying to save your costs.
Minimum.
Oh, we don't care about
That
cost.
way when you
No,
roll.
because I would assume the
That's
shoulders, that gear is
That-
expensive.
I've had to cut a jersey, it doesn't,
Yeah.
I mean, I don't even think about it.
It's,
We just have to make sure that initial assessment's done, that's why we're.
Sorry.
yes, she will what part of his spine is
Very good,
bothering
Dave.
him, and then we'll go from there. Like I said, if he were to run off the field and say, Sheila, my gosh, like my neck really hurts, my hands numb, and all that stuff, he already ran off the field. We're not gonna spine board him. We're gonna sit him down, restrict his motion, and put him in a collar, and then you guys are probably gonna come over, he's gonna stand up, get on the gurney, and then go.
In most cases too, if there's a situation like that and they are saying like they're walking out and they're like, my neck hurts, I will instruct them, go ahead and take your helmet off immediately. And take your shoulder pads off immediately, if they're able to.
So I have found and probably most of these people in this room, people that have C-spine injuries will hold their own C-spine. They'll hold their head because it hurts. So, interesting.
That's good to
Yeah,
know.
it is good to
Yeah,
know.
people that have, honest to God, C-spine fractures,
They don't move.
they hold,
They don't wanna
they will not
They
move.
don't move.
Yeah. You had a
It's weird.
question, I'm sorry.
I did, but you kind of answered it along the way, so we're good.
Okay.
Okay.
Yep, we're good.
We don't get to play with this stuff very often.
No, that's why we
These
do
guys
this.
probably get to do it all the time. I
No,
don't, so.
that's why we do it every year, just so, like, we can get comfortable too, because,
And being able to work together so that you guys know what we need when we're coming in and we know
Yes.
what you're doing when we're coming in, it does help.
unfortunately, there has been this, I don't know, stigma of athletic trainers and EMTs butting heads. I've never personally had that, so I hope, and I want to thank you guys because, and I think it's due to just communicating, trying to establish relationships. We want to know where you're coming from, you want to know where we're coming from, and just working with each other.
'Cause it's not
For the
about us.
common cause, yeah,
That's
it's
right,
not about us,
It's not about
us,
that
it's about them, exactly. So, yeah, sometimes egos do get in the way.
Do you want to practice getting him on the board?
I think it would be more beneficial, the log rolling and all of that stuff we do on a daily basis.
Do you guys prefer the 8 people lift versus log roll? Do you know what that is? Like 8 people actually.
Well,
stretch
yes,
like
but
that?
I'm just wondering where you're going with the
There's
question.
only like, I mean, it's,
Different
yeah.
EMTs do things differently. Like we work for,
Oh, sorry.
Lord Jesus.
we work for OSS, so we had the EMTs come and talk to like our entire crew, but we don't work in York, so it was kind of what they said was redundant to us. They prefer scoop stretchers. They said we really don't like to use backboards.
I'm a scoop, it's really, so that's
We have-
provider dependent.
Yeah.
We do carry scoop boards, we carry the long
Reeves.
boards, and we carry a Reeves.
Okay.
So, I'm a big fan of the scoop personally.
And I think we are this is what we were taught in school. Spine board, backboard, spine board,
Old
backboard.
school, yes, that's what it
Yes,
always was.
but the scoop makes more sense unless you have a severely
Scoop is the old school.
I was gonna
obese
say, for the
person
record,
that
scoop
you're
is old
pitching
school,
there, or they
sister.
can tumble out or whatever, but you usually strap them on then,
And
right?
I will tell you that we have, if that's the case, you know, you have a Husky football player, we have a Reeves, and the Reeves probably would be better than the Scoop just because it's wide.
What is it? I don't know.
Good, because I have a,
It is
So I'll show you a Reeves, and there's a
Careful.
lot of mega movers.
Yeah.
That's
Yeah.
the other option.
If you
We
could
have.
show us,
I've
I've
never
never
known
seen
it.
a Reeves.
The mega mover doesn't give much spinal support.
Right.
Okay.
Okay, but that goes with your 8-person carry. It's like, for
Yeah.
example, if we were going to do an 8-person carry, we probably would use it in a non-spinal injury. We would use like a mega mover in the field or something like that. But I'll get a Reeves and show you. The
Sure.
Reeves is harder, but it's not as hard as a long board.
is it a weight,
And
is
it's
it a
not
weight
weight.
limit thing or just size in general?
Both.
Okay, because I have an 8th grader that's 6'5" and 280. 8th
Eighth
grade.
grade?
8th grade.
He-
That's insane.
And a valid 8th grader, like birth year.
Yeah, like,
He's getting a scholarship. that's,
Yeah.
that's a happy mom and dad right there.
The Scoop will not work for him, obviously.
Yeah.
Because he's longer than the Scoop.
okay, that's
So the Scoop's about 6 feet long, whereas a Reeves,
So these are actually the two different things that we have. One is Reeves, and then you were talking about the possible spinal injury in the person sitting down. So we actually even have what we call a headboard that allows us to spinal. I know we don't use it, but it does allow us.
They work.
if
They
something-
do work.
If
They
somebody
do.
is in a sitting position. That makes
okay, that's, Richard was
But this is just something that we use like in a sitting position. So let's say that that patient got up and all of a sudden they got up, they walked over and all of a sudden we shouldn't be moving them anymore. This is what we can use.
Gotcha.
This is something that we use to stabilize in the sitting.
Interesting.
And you can completely immobilize the C-spine with that. I mean, it literally wraps around the body and the head as
Yeah,
well.
I had it upside
Wow.
down. It goes this way. So this would.
I'll say that's a big head.
Yeah, it sits like, it basically would sit like this.
But again, if you're 265 pound
That's not
patient,
been around.
That's
here.
not gonna work.
fit.
No, but these are just some of the, I wasn't talking about that person.
Thank
But
you.
again,
He's a diamond in the rough.
but again, if he's got all that stuff on,
Right. I didn't put it before you, so I'm just showing stabilization.
I mean, I'm just, listen, I'm in my brain working the spirit.
I know you are.
All right, so this is the reeds.
Yeah, so this is nice, it's a bit like a big flexible sled, but it
Yeah,
still
that-
has the nice hardwood underneath it.
Okay.
Support,
But it contours to the
handles
body.
too.
yeah, you can contour with
And
it.
you can still lift and whatnot.
I feel like you could grip better with these
Yeah.
too.
yeah.
Good.
This is typically
And
what
that'll
we
take
like to
you
use.
pretty good. We usually also carry sheets on, and use sheets to.
You carry 400
Yeah.
pound patients.
These typically come off the truck with a sheet already on them, so that way we have somebody move them off of this. Because this, just like spine work, it's uncomfortable.
Did you like the tablecloth thing?
Sometimes.
Get them off.
Yes.
Yeah, pretty
That's
much.
right.
Yeah.
Oh, absolutely, we'll get like.
We
Well, that's what they
practice.
told us in our meeting, and I was like,
Pull
how do you do that with a 250 pound football
Practice,
player?
practice.
Yeah, I can see your magic.
Oh, we would secure them.
This is kind of like, the European soccer thing where they have a little thing and they're like
Yeah,
silver
those
faces and
were-
all that.
They run off the
And
field.
they like drop them, they're like,
Now, the thing about the Mega Mover is that
you
it's
ever
not,
see those videos?
it's just a cloth. I mean, it's cloth material. So that Mega Mover is more about
Just like the
not
support.
necessarily extricating a patient from the field, that's more about lifting a
Yeah,
patient
so
off
I
the
know for
ground.
transport, they like to cross the arms and like cross the bands over top, so their arms aren't flapping everywhere. If they're getting resistant, they can't try and fight.
We're not gonna use it.
I mean, that's a good idea,
It is, like,
Gotcha.
but you got a lot of,
Yeah.
you'll have a lot of.
And something on your chest, you're already panicking.
I only thought of it because
Get
she
off
said
the
it
field.
8%.
You go to
Yeah.
boys for hours here too.
Yes.
Thank you.
Right. Right.
Yeah, no, no,
It's not necessarily carrying, you pick up, you physically pick them up and then put them back down on the board and then pick the board up and
I
put
think
the
that's
board
why
on.
we went to the grass last time was the scoop stretcher.
Yes,
See how it
But if
yeah.
you're going to that point,
Yeah.
you're lifting a patient off the ground, you might as well.
It takes up grass. It does cut the grass.
Yeah, and I think that's what we talked about, like, that's probably an ideal. Like,
Yes, they do.
The oversized, like, chicks was.
How big is your biggest kid?
280.
That's an 8th grader.
That's the
No, yeah,
How big's
that's-
your biggest kid?
Yeah.
You got a 400 pound kid?
No, but, oh, yeah, yeah.
Yeah.
So the scoop
Big
ball,
boys.
they'll,
Yeah.
it's gonna be.
And do you
two-
carry each of these on your
Yes.
units?
Yes.
Okay, so it's not like if you show up and we're like, hey, do you have a scoop? You're like, ah.
Just tell
okay.
us. Or
Okay,
we're gonna bring what we think is necessary.
okay.
Here's a scoop.
Here's the scoop.
Yep.
It'll pick up some grass at the top, but
Yeah, and that's what we talked about before, like if someone's really big, you can accidentally
Pinch
pinch
it,
on them, but.
It actually really doesn't pinch.
I've never
Yeah.
pinched anybody with one.
It pulls.
That's why
Especially
you're
if it's
better
parasitic.
at it than we are.
Oh dang, pinched him, sorry.
Maybe if worst case,
But
close.
Yeah.
here's the problem with the scoop.
Why are you gonna hate on my scoop?
I'm not hitting on your scoop, but if you're concerned about somebody's C-spine, right?
Oh, I'm not, if I'm true C-spine.
No, but even moving them off the ground. If they have a cervical collar on, how can you move them off the ground and still hold stabilization? With the reeves, you're gonna be able to
It's not to come in and secure.
be able to secure them a little bit
So
better.
how do you get them
versus
on here? Do you do the log roll and roll it
Yeah.
on
Same
top?
thing.
Yeah.
Okay,
Fold it and log, yeah.
got it.
We kind of put the ends under. Well, we could, Vinny could lay down and we could show you how we put it.
Yeah, say, I like this better than this
Yeah.
because sometimes like their body like covers the handles.
Yep.
And I just remember like,
It's a
my
awkward.
basketball player
Yeah.
or whatever, like just trying to help lift and I was like,
That is not for
shimmying,
wide
you know.
bodies.
Lay down there.
No, it's not at all.
Lay down.
And if you're coming to football, good chance you're coming there for a wide body. Alright.
I was gonna say Nate could do it.
She ain't playing football.
Hey, you never know. There's a women's league now.
If you
She's a kicker.
All those bugs on the field?
C-spine?
Spiders, remember. Stop it!
Where, you mean that little one there?
You and Billy, man.
It's a little one.
I wanna see her in a helmet. Grab her C-spine.
Somebody grab some.
Ready? 1, 2, 3.
On Jan's couch, go ahead.
I got my knee.
You good?
So in this point, isn't that when you guys
1,
typically
2,
palpate the
3,
spine?
Yeah, I would, if I,
And
yeah.
Most of us, the jersey's off at this point.
Yeah.
And you
then we
guys
would
are gonna
just
do the,
do a small roll this side.
1, 2, 3.
and then you don't have to do the up, down, all that motion.
Yeah, I
I like the reeds better. We need the,
Prepper.
We'll just bring it. That's what
just
we'll bring.
request this.
yeah.
Wait a minute.
I'm surprised nobody's ever talked to us about reeds, like in any of our CEUs.
That's the old, yeah,
this one.
that's the transition that's got it done.
Yeah.
As you get 6 feet, 3 on each side.
Crisscross.
This is the old
Okay.
one.
I was
So is this what they use in the Coast Guard? To like, when they, like,
No,
at the basket?
That's a
like,
basket lid.
It's what?
That's called
It's a stove.
Stokes.
The fire department carries one of those. So
That's an actual.
when she's laying on
Then
there
they lay in
and
it.
we pick her up, the reeds actually folds in on her a little
Yeah.
bit and pulls her neck.
Don't jump in, Josh, yeah, don't get ahead of the tree.
Or you could always do.
Now, turn her over.
Right, there's the. I will kick my shoe off at you. Turn her over, I was like, oh, please, no. I didn't sign up. Whereas, when you put them on a board, unless you're putting the blocks on, their
Yeah.
head's all over the place.
Yeah. I like the reeds. I vote reeds. Told. And a lot of times, when you guys kind of do this with sheets, like if you, I know you guys always carry, but I know lay down Lancaster, a lot of them didn't carry backboards, so they would use sheets to transport
Yeah.
to the gurney.
We could, yeah.
Gotcha.
Sometimes you can't get a reeds.
Ready?
Then we can pick her up on the sheet.
Somebody grab the
Now
reeds.
they remove the reeds.
Ready? Everybody got the reeds?
I got it.
Okay. 1, 2, 3.
One out the bottom.
And you do this in the ambulance.
Yes, or the back of the, or coming in.
Yeah, or as soon as we put them on the stretcher, we'll say,
Yeah,
hey,
and I'm sure
pull the
that's a
strap
lot more
on.
comfortable than having all those rods underneath your back, and that thing is the death
Oh,
of so.
I know,
It's
definitely.
like sleeping on a freaking diving board, no big deal.
Okay. Now again, those do break, it's all, it's just plywood. They do break, and they do bend.
But they're definitely much easier to store and get around than
that thing.
that
Yeah.
thing too.
Yeah.
Yeah, I donated two of ours here a long time ago, because they were just sitting in our corner, and I was like, not using these, I'd rather donate them, so. I mean, it was good practice for a little bit with the class that we had, but.
This will come from one.
Yeah, there's a, yeah, that's not tough.
Is there anything else? Do you guys want to practice anything? Are you good? You guys are obviously professionals and know how to log roll and get them on, so I don't think you need to, and
So straps are important.
I have a couple of questions for you about your people in the stands.
those people.
Yeah, like people that came to celebrate or the football.
The tailgaters or just the normal?
No, the ones that are in the stands falling on the steps.
We had nothing to do with that.
Because you're not gonna treat them at all.
No.
We're all there, we're gonna bring what we need to bring and take care of them.
Yeah,
So
Because
if
you
someone has
know,
a heart
we're,
attack in the stands.
but we did have somebody that had a stroke
Yeah,
here.
that's what I
And we physically, even our team physician, we are not contracted to leave the game. because
okay,
of the-
so
yeah.
we aren't either. We're there for your game because it has
That's
to be
okay,
an
I was
ambulance
just
there.
curious how they come up. Now, do they, does it work the
So
same
we're
on
gonna call
as this one?
somebody else.
Okay.
So yeah, as long as they have that like
And that
indentation.
second or third new
Does
ambulance is-
this part, once you have this up, do all they,
Yes, I am
do they
aware
all
of that,
flip
yeah,
up?
and I think that's why,
Do you know what I mean,
They
does
should,
this
yeah.
part, does this part
because
flip
of
up?
that stroke
Because
that
this,
did happen,
let's say, football player's on the ground, right?
you guys now
He's
come
not
with the
breathing.
second fire.
You got these two pieces
truck
out,
person at.
but not waiting for you to unscrew these.
Am I wrong?
So yeah, you can flip
Because
that up.
Okay, that was my.
not last year,
I don't know.
not
if
COVID
it's
year,
working.
not COVID year, but
As long as you do, like,
Fire
Yeah, they started coming after that.
Yeah, again, it's just so that we can get to this part.
And I think Mike Craig put that in the
Perfect.
contract because it took a little bit, and people kept going over to you guys in the corner, and you were like, we called them already, we can't find, we can't
Yeah.
do it, we're contracted
But like,
here,
it
so.
works the same way.
Because you guys we would have to stop
Cool
the
deal.
football game. So.
Okay, just making sure that you.
Yep.
You're out, huh?